Good afternoon, and thank you for joining us once again. As I've said multiple times, we have been grateful to the media for helping to get our message out during this particular crisis. I'm delighted to be joined today by Paul Boland, Senior Vice President of Human Resources, and I'm Dr. James Jarvis, the Clinical Lead Incident Commander for Northern Lights response to the COVID crisis. Just a few brief remarks. One, I want to remind everybody that the single best thing we could be doing right now is practicing social distancing. Staying at home unless we need to go out for essential things like groceries or to visit for medical care or something along those lines. Practicing good hand washing and good sneeze and cough hygiene and etiquette in order to make sure that we limit the spread of this disease. I want to briefly talk about the alternative care sites going up in both Portland and Bangor. Bangor, one in particular, will be housed at the Cross Insurance Center. I want to assure people that the intent of these alternative care sites is to be used only in an extreme circumstance. We are going to avoid using them as much as we possibly can. We feel the best place for people who need acute care would be in a hospital setting. And so here in the Bangor area, where we're working in a cooperative with St. Joe's Hospital, Penobscot Community Health Centers, and the City of Bangor, as well as partnerships with the National Guard and advice from federal and state agencies, it is our intent to be able to keep all of our acute care patients within those two hospitals and only use this alternative care site when absolutely necessary. And with that, we'll open it up for questions.
Hi there, this is Morgan Sturtevant from WABI. My question is, I'm not sure who would be the best person to answer this, maybe Dr. Boland, but when it comes to furloughing employees, what is Northern Lights' position on that? What will be the circumstances surrounding that?
So we've been very clear in recent communication with employees that we have no intention of laying employees off or reducing pay. We have offered voluntary furlough in some limited circumstances where employees have approached us with additional stimulus dollars, making unemployment a more attractive alternative for some whose positions aren't urgently needed in the incident command structure. But far more employees than that are being reassigned and are working in a number of different positions that do differ from their own, but are part of our incident command structure to provide services to the community during COVID-19.
All right, thank you very much. My next question is, I know that these alternative care sites are in Bangor and Portland and are, as you said, are only if necessary. Are there other alternative care sites in other regions of the state being planned right now, or is that something that's not being looked at?
So one of the other jobs that I've been doing is working with the state. The state has several work groups in its response to the COVID-19 crisis. And so we are looking at other alternative care sites. Right now, though, the need is greatest in the city of Portland and then next here in the city of Bangor. And so that's the reason why those two sites are being set up first. There may be some additional sites depending on need as we hit what we think will be a surge in the coming week to month.
Okay, next up, I believe we have is Patty White from Maine Public.
Thanks. My question is for Dr. Jarvis. Dr. Jarvis, yesterday the CDC announced a surge of cases at a long-term care facility in Belfast. I know it's not operated by Northern Light, but Northern Light has several nursing homes. And I'm just curious, with a sudden surge of cases in one facility, has that changed how Northern Light is how it's managing its nursing homes? Is there more testing, or has that changed anything?
So our day-to-day operations have not changed based on that. It just gives us more pause. We do feel that the greatest risk for seeing large numbers is if our long-term care or nursing home facilities have outbreaks like the one that you just described. It just simply puts us on a more heightened alert that in all likelihood they will need acute care services from individuals who are housed at those institutions, and so we're just more prepared to receive them. But from our day-to-day standpoint, it continues to be Northern Lights' response that we will protect our staff, our patients, and the community as best that we can. And so we do not feel that we need to do any additional precautions beyond those that we have already undertaken.
And I know that testing in long-term care facilities was bumped up to a top priority towards the end of March. Are there enough tests so that testing is happening, or do you think that there needs to be expanded testing in nursing facilities?
So the key to remember is that testing is only accurate when we're talking about individuals who have symptoms of COVID-19. So individuals who are asymptomatic, we know this test is not a good test. Being told that it's negative in an asymptomatic patient doesn't actually state that it is negative. We know this because we know that out in the community there are individuals who are asymptomatic but yet still spreading the virus because they're infected with it. And so I want to caution people about when we hear of large numbers in a particular nursing home, are we testing more in the nursing homes? We should still be limiting that to individuals who actually have those symptoms. At Northern Light, we do feel that we have the capabilities to continue to test Tier 1 individuals without having any concern for our resources, and resources are the reagents that we use to run that test and the lab personnel who actually do the work. And so it's important that we continue to conserve testing until such time when testing is more readily available, which we all hope happens soon.
And next up, we have Bob Evans from News Center Maine. I don't know why it's giving me a hard time unmuting you, Bob. Here we go.
Hi, Dr. Jarvis. Good afternoon. This question is for you. What is the plan for when the Cross Center will be set up, and what kinds of patients do you see will go there?
So I will tell you that we are well into the planning stage. In fact, we had started talking about what we would use for an alternative care site before the state reached out and said this was the location that they wanted us to use. I will tell you that the community of Bangor has been tremendous. You're well aware of the Bass Park testing and assessment site that we have set up near the Cross Center. That was a collaborative agreement between the City of Bangor, St. Joseph's Hospital, Penobscot Community Health Centers, and Eastern Maine Northern Light Eastern Maine Medical Center. You'd think I'd get that one right. And so we've already been doing those planning stages. So it allows us to be a little bit ahead of the curve on this one. And so logistics are going on right now. We finalized a floor plan for what we believe the facility will look like when we are finished. And all of those works are underway, and we expect that we can have it ready within 7 days.
Well, Bob is somehow there. You go. Okay, Bob.
What kinds of patients do you see? Could those potentially be COVID-19 patients, or will they be other patients from the hospital that will be moved there?
So again, I think it's going to be the needs on the ground that will determine exactly how we utilize these facilities. Again, I want to stress that we want to not use them. We're going to take every effort we can to not use either of these two facilities. I will say that our current plan would be that for those individuals who require acute care, have gone through that acute care episode but still need a little bit of convalescence before returning to home, or if they don't have a home to return to, those are the individuals that we've identified as most likely going to these facilities. So that would be somebody who came into the hospital for a pneumonia, or maybe needed to have an operation, and are just not well enough to go home. So normally they would go to one of our skilled nursing facilities, an acute rehab facility, or a long-term care facility. We expect that there will be challenges in getting patients to those institutions because of some of the things we have already talked about. And so we plan to use these facilities for that. I do know that in the city of Bangor, they also have a much larger homeless population, and there's a concern there of not having adequate facilities for their homeless population, and so they may use their alternative care site for something along those lines. That is very similar to what we see in other cities, particularly in Boston right now.
Hey, next up, we've got Charlie Hacker from Bangor Daily News.
To Paul and Dr. Jarvis. I guess probably both the questions are for Dr. Jarvis. I know a few weeks ago there was talk of Northern Light working to process COVID-19 tests, and can you give me an update on whether it's currently able to do that, and sort of what the delay has been?
Yes, I'm glad. That's a great question. So I'm delighted to be able to say that Northern Light Laboratories is able to do their own COVID-19 testing. So we're no longer relying on the state lab or farming those tests out to private companies. That has been a game changer for us across Northern Light, but particularly at EMMC, because we are now able to get our test results back in hours rather than days. And so that's been wonderful. When we first started talking about that, we would have an average of about 20 patients who we call persons under investigation or trying to determine whether or not they have COVID-19. And our typical census for that now is only 1 to 2 people waiting for those test results. So it has been a game changer for us. When I talk to my colleagues around the country, those facilities that do not have such adequate lab supplies are struggling with the conditions of trying to identify which individuals are positive and which individuals are negative in order to protect that very important personal protective equipment. So we're very fortunate that we're able to do that in-house.
Just a quick follow-up on that particular question. When did that in-house testing start happening, and where, what locations available at?
Yeah, so I can't tell you the exact time frame for that, but it's been about 2 weeks and that we've been able to do that. And so that service is all of Northern Light Health, so all 10 of our hospitals. I will say our Mercy Hospital also does use an outside lab depending on particular needs.
And next up we have WVII. And just give me a second, TJ, to make sure you're unmuted.
No worries. Thank you, Chris.
Yep.
Good afternoon, Good afternoon, Dr. Jarvis. How are you?
I'm good, TJ. How are you?
Excellent. 2 quick questions. One, specifically, can you say when the National Guard will start moving equipment into the cross center?
I can't tell you that. So that will be discussions between the state and the city of Bangor, as well as bringing in Northern Light Health from its logistics standpoint. I will tell you that when we met with the National Guard earlier this week, they could start doing that, frankly, within hours of getting the go-ahead. Right now, we're laying out the floor plan and making sure that the facility meets our needs and that it has the infrastructure in order to take care of patients that would need some level of health care. We hope that being very low level of health care.
Laying out the floor plan, what number of beds are you determining are best for that area?
So we'll initially start off with approximately 50 beds. That is by request from the state of Maine. We can ramp that up to be anywhere between 80 and 100 if we need to. The plan that we drew up and the contract that we are using, like I said, should get the facility ready to occupy patients within 7 days, and our expansion should be within 24 hours if need be.
I'm sorry, Chris, could I just throw one more question on Dr. Jarvis?
Okay, really quickly, TJ.
Very quickly. Dr. Jarvis, you mentioned that you expect a surge to come in the next couple of weeks. In this instance, could you define surge?
I really can't. There are many predictive models out there, some that actually say that the surge will hit us as early as early next week, and some that put it as far out as June and July. We tend to follow the one that the state is using, and that would put us somewhere around the 14th to the 21st of April. Again, Maine has a large geographic spot, but its population is so spread out, it's hard to predict county by county. And so we're just doing the best that we can and being prepared as if tomorrow will be the day of the surge, and hope that it's not.
Hey, Kate Koff from Ellsworth American, you're up.
Thanks so much. So my first question is for Dr. Jarvis. So I'm not sure if we know, and I'm guessing you probably can't tell us, if any of the healthcare workers who've contracted the virus are at employees of Northern Light, but we've heard you say a couple of times that you feel like the PPE supply is adequate. So I'm wondering if the PPE supply is adequate for now, can you give us a sense of where the healthcare workers are contracting the virus? You know, are they getting it in the healthcare setting, or is this a community transmission?
So I won't talk about specifics, because just because they're healthcare workers doesn't mean they don't deserve their privacy. So I will maintain their confidence in their privacy. I will say that the first number of healthcare individuals for Northern Light, some of them we feel did contract the virus through contact with patients. Most of them, however, have been through community spread, and we have a very good tracing program for that. The risk, however, for healthcare providers is high. When you're face-to-face with individuals who are positive for COVID-19, the risk of transmission is high, and so there's always that kind of fear. But day in and day out, we always deal with patients with infectious diseases. It's what we do. It's why we're here. And so this is not something that it's certainly something that we don't take lightly, but it's also something that's just part of the realities of being a healthcare worker and what we do day in and day out.
Thank you. And my second question is likely for Mr. Boland. Can you talk a little bit about support hospitals that may be struggling financially?
Could you repeat the question? Your audio blocked out for a moment.
Oh, sorry. I would like Mr. Boland to talk about what plans you have to help support hospitals that are struggling financially.
Hospitals within Northern Light, you mean?
Yes.
Well, we have, as a system, we have, we plan for eventualities and disasters to some level. Certainly COVID goes beyond that. But in terms of financial planning, our organization is strong, and we believe, taken care of a number of things that would have had to happen beforehand in terms of pre-planning and preparation to be able to support one another through a crisis such as this. We've been very fortunate in our approach with our employees. We're relying on them, our communities are relying on them, and they in turn can rely on us. We're leaning in because we want to make sure that our employees are understanding that they're very well needed all the time, and certainly during the COVID-19 crisis.
Okay, next up, I believe we've got Leslie from Penobscot Bay Press. And really quickly, Ben, I think the audio sounded like it broke up a little bit on the end of Paul's answer. So I don't know if you can boost it at all. There was a little bit of drop off.
So I guess I should go ahead, right?
Go right ahead, Leslie.
Okay,
Yes.
take that there. Yes, I'd like to ask Dr. Jarvis, do you have any sense of whether the social distancing that's taken place in Maine has flattened the curve so far?
So I can't say whether for sure it's flattened the curve. We do believe so. If you look at our numbers per capita compared to other regions, our numbers seem to be a little bit lower. That may simply be a matter of timing rather than what we have done, but we do believe that our governor's office swift action in response to this has been beneficial for the entire state. There is some natural social distancing in Maine. We only have a few urban centers, and so I think that has helped as well. But there is no doubt about it that the only way we will bend the curve is to continue practicing social distancing and remaining at home, as has been described by the governor.
Thank you. My second question is, how do you envision the social distancing measures being taken away? In other words, how are we going to get back to normal?
That is the question that no one has an answer for, and yet lots of people have opinions. For myself, it's going to have to be seeing that our rate of new cases is dropping steadily, and that we see fewer and fewer deaths from this terrible virus. And so I think it's when we can feel comfortable that the amount of virus in total out in our communities has dropped to a level that social distancing will no longer be necessary. Can I answer the question as when is that going to be? I can't. Unfortunately, right now we can only test to see whether or not somebody has the virus acutely and actively. We hope to have a test that will be able to tell whether somebody has already gone through convalescence. But really it's just continuing doing that good monitoring. It's why it's really important that we do testing, and we wish that we could test more individuals who are symptomatic in order to know exactly what's out in our communities.
Okay, and next up we have, last but not least, Molly Shelley with the Morning Sentinel. Molly, give me 1 second. All right, your mic should be unmuted now.
Hi, my question is for Dr. Jarvis. Are you able to put a number on how many patients you're testing per day?
I can't tell you the exact number per day. I will tell you that Northern Light Health has the capacity to test between 850 and 1,000 individuals per week. and we often are very close to those numbers. And so any given day, we are testing somewhere between 100 and 150 individuals. Many of them are healthcare workers because they are part of the Tier 1 category, but it's important that we continue to have these tests available for patients who are sick enough to require inpatient care, and then to be able to try to return our healthcare workers and first responders back to work. And then, as we mentioned before, being able to test individuals in long-term care facilities or shelters or group homes in order to limit any possible spread in those institutions.
And the tests, are you guys importing them from other places in the country or abroad, or are you receiving them from Puritan Medical Products in Guilford?
So I can't answer that question directly. We can certainly find out that information and give it back to you. I will tell you that we have a single supplier who's supplying us with the reagents to do our test, and that we have commitments for them to continue with the numbers that we currently are able to do. And so that's where we're working right now.
Thank you.
Okay, I have a few more minutes, so I'll tell you what, since I've got you up, do you have one more question you'd like to ask, Molly? Or can I move on?
No, I think I'm good.
Great, thank you, Molly. All right, Charlie from Bangor Daily News had an extra question he just put in the text block to me, Dr. Jarvis, I believe it's for you. And the question is, can you give an update on instructions employees are getting for PPE use, including whether used gear should be set aside for possible reuse in the...
So yes, I can answer that question. So right now, across Northern Light Health, we are requiring our staff to wear a mask if we feel that they're going to be within 6 feet of another individual, whether that be a patient or another staff member or other members of the community. So we are providing procedural masks for all of our employees. We are looking at our policy as well to make sure that we are protecting those that are in direct contact with persons under investigation or COVID positive, allowing them to utilize those precious N95 masks. Of any of our material, we continue to figure out ways that we can do extended use for things in a safe and effective manner. For our N95s, we are collecting them after their use right now for possible reprocessing in order to be utilized if that's a last resort to keep our supply going. Right now, we do not feel that we will need to use those reprocessed masks, but we are collecting them just in case, and we do have a test or a procedure to do that has been validated by the government.